Morning, welcome to Little Steps Live. Welcome back. I'm joined this morning with Shay, the founder of Little Steps Asia, and Dr. Nicholas Tsang. So Dr. Nicholas is a dentist here in Hong Kong, and we have tons of questions, and please make sure that you ask us any of your questions around dentistry, especially for kids, because I know it's quite a big area of greyness for us all. And definitely the summer is kind of over now and parents are kind of getting back into making appointments, so it's the perfect time for us to kind of really understand how do we do it, when do we do it, and all the rest. So I wanted to ask firstly a bit more about yourself and where you're from and how you got into dentistry.
Okay, so my name is Dr. Nicholas Tsang. Okay, I'm originally from Hong Kong. I was born here. Then I moved with my entire family back to Canada. Okay, did all my schooling there, did my science degree there, and then came back to Hong Kong for dentistry. It's just back to my roots, I guess.
Yeah.
Okay, so I've been practicing a few years now, several years, and it's pretty good. I mean, it's very busy, especially with kids and adults. So I'm loving it actually.
Well, I know you definitely have a little bit of a cult following here in Hong Kong, especially for the mums kind of getting started with the kids and going, because it can be quite scary. So we're really pleased to have you here. What do you feel is the best part about being a dentist?
I mean, as a medical professional, the best part about being, a dentist or even a doctor, it's just basically going to work every day. I mean, patients are coming in and, they're coming to you with teeth problems, questions, and just being able to answer their questions, being able to help them out, that's pretty satisfying during the entire day. I mean,
rewarding,
that's very rewarding,
Cool. What does a normal day look like for you?
A normal day,
is there such a thing?
We're looking at, plenty of patients, 20-something patients, a full day, 10 to 7. For now it's more like 10 to 8 now. We were working overtime just because, some patients, they've got a lot of work to do.
Yeah.
And we've just got to overrun sometimes. And,
to get them in, right, for the after work hour.
Yeah, but normally it's a pretty full and busy day, starting from 10 to 7.
Working with, I know you work with children and adults.
Yes.
How is it different working with kids and adult teeth?
Right. Now, let's get to the adult first, right? I mean, with adult teeth, we've got a lot more teeth, right, for one. But the good thing about, working with adult teeth is that adults are more understanding of what treatments is going on, right? Like, let's say if I'm explaining certain things to you, okay, even just a cleaning, okay, you understand immediately what needs to be done. Because most adults have been to the dentist before.
Right.
Right. Many times.
Right?
But
if not, you need to go now.
Right. If not, it's a good thing you're here now. It's a start. But with kids, when parents are usually bringing the kids in, it's usually the first time, or it's usually their second time, or they're really afraid. Okay, and that's the patience thing. That's different. You have to be very, very patient with kids. You have to, explain to them, every certain thing that they're seeing. Okay, even just having them in the reception, having them playing some, games that we have for them, and then coming in and introducing to yourself. That's a barrier already, right? They're exposed. They come in and they see somebody with a mask on, with a gown on, and that's scary. Right?
Yes.
With gloves, and they're like, oh, what is this? And then all these instruments, and that's the focal point, right? That dental chair is that focal point.
Yes.
And they're like, okay, I have to be here, and everybody's surrounding me, the nurses, my parents, what's going on, right? And that's when we have to really ease them into it, right? Yeah. And that's the patient's difference.
That's the talent.
With the kids.
And that's why you have such a great following, right? Because you're so good at it. I remember the first time I brought my kids in, and we walked through the little hallway, and Peppa Pig was playing, and and immediately I was like, yes.
I watch a little bit too much.
You probably do. But it works. It works. It definitely helps to keep them calm, and then they're a bit excited. They're not, as you say, that focal point of a lot of pressure that everyone's suddenly looking at them, and that makes them feel a bit uneasy.
And kids are so honest, so you can tell if they're nervous, you can tell if they're comfortable, whereas adults can hide it a little bit more. So you do get very honest feedback.
I do.
A little white knuckle on the
So we've got to talk about a subject that we all know, sugar.
Okay. Right.
We all know it's not good for your teeth. We know that. But can you tell us a little bit about good and bad drinks, or just your insight into sugar and and recommendations on what to avoid with regards to the teeth.
Okay. Well, in terms of sugar, I mean, when you have sugar in your mouth, it's all bad.
Yes.
Right, for your teeth. I mean, fizzy drinks, chocolate, candies. Anytime you have too much of that, it's going to be something that can let the bacteria in your mouth destroy your teeth. Right?
Yeah.
So any time you have even just carbohydrates, okay, because let's say bread, it's got carbohydrates. You know, that's essentially that sugar, right? If you've got that stuck on your teeth for a long period of time and it's not cleaned off, that's bad, right? Okay. So essentially, it's not really about thinking about what are the worst foods or what are the best foods that are for kids. I mean, there are good foods for kids. I mean, but let's say if you've had ice cream, if you've had chocolate or any fizzy drink or things like that, the most important thing is really to have your teeth really clean afterwards, right? Okay. But that really doesn't mean that you got to brush right away.
Right.
Because brushing right away is actually not a good thing.
Oh.
Okay, like right after eating, even just for adults or even for kids.
Yeah.
Okay, you don't want to brush right away.
Like right after you're done. Yeah, okay.
Because what's going on is, let's say you have candy. Let's say you've had sweets, right? The sugars are on the teeth. It's in the plaque that, sticks to your teeth. Okay, and there's bacteria in it too, in the plaque, right? And that bacteria is slowly, and with the acids in the food, it slowly demineralizes the surfaces. Okay. And it takes, a bit of time, let's say 20 minutes, for the saliva, the minerals in the saliva, to remineralize the tooth surface, to make it strong again, essentially. But if you're brushing right away during that period of, that the teeth are very weak, when it's demineralized, just slightly, right? You're able to brush away, parts of the enamel of your teeth. So that's why you have to wait a little bit.
So there is something.
That is something I did not know.
But there is something into over brushing. I think, because I definitely know my husband struggles with that when he went to have his teeth done, and he almost brushes too much, and it probably is that timing that kind of wears away the enamel.
Yeah. So let's say you brush right away, and let's say your technique is not good enough. Right. It's not correct that after you've brushed, not all the plaque is off. Parts of your enamel are already weakened, and then that makes it even easier for the bacteria to degrade the teeth, right? Yeah. So I mean, essentially, it's very important, not to brush too early, like immediately after the meal. But it's also important to, when you're brushing, to have the technique right that after you've brushed, it's all nice and clean. There's actually no plaque, no biofilm on top of the teeth. Because that's when the bacteria is able to, degrade the teeth. Yeah.
And can I ask on that, electric versus like a normal toothbrush?
Right. Really, once again, no preference. Okay. For as a dentist, I mean, seeing patients every day, some of them use electric, some of them use manual. I mean, some patients with manual toothbrushes are brushing better than those with electrics.
Yeah. Okay.
Right?
Yeah.
And it's really the technique.
Okay.
Right? We want to aim towards the gum line because a lot of patients are missing those areas. Okay, some patients are brushing too much of the gum line area. They're doing it too hard, too aggressively, thinking that, I need to keep it really clean.
Yes.
Okay, and that would cause the enamel to wear away, and then we get sensitive teeth, right? But some people are really not really aiming towards those areas.
Not getting high up into
where the gums and the tooth, the crown of the tooth meet, right?
Okay.
And that's where most of the plaque deposits, or in between the teeth.
Yeah.
Right. So if you've got a good technique, it doesn't matter electric or manual. But obviously, for let's say kids, they're not really kind of inclined to toothbrushing. They're always just running in there and then, doing two or three times and I'm done. Because they want to go play or whatever. So, what I usually suggest to parents is that, make toothbrushing kind of like a game.
Okay.
Right? Or it's actually, I would think it's actually better with kids with electric toothbrushes. Because they kind of think of it as like a toy.
Yeah.
And then they're actually playing with it. It's kind of vibrating in their mouth and they actually like it, right?
Yeah.
So introducing that electric toothbrush would be a lot better for kids, I would say. Just because they're having fun with it. And the electric toothbrush is doing the moving around, right? And it's not so technique sensitive. Right?
Yeah.
But for adults, then it doesn't really matter as long as you got the technique right. Yeah.
The electric toothbrush also has the timer on.
Right.
So you can let the kids know, right, once the...
That's right, yeah,
it turns itself off, you've got to keep going until it turns itself off.
Yeah.
It's definitely evolved since
very
young.
And the kids ones, they've got all these, cartoon characters.
That's right,
exactly.
So they would like that a lot better as well.
Yeah.
Like you really get it for them, and they really think it's a toy.
Yeah. So that creates the fun element.
Good tip on that. Good tip on that one. Are there any foods that are actually good for your teeth, like that you can eat to make, maybe you've got weaker teeth, or is there anything or is that just kind of going above and beyond what you need to do?
That's just going above and beyond, right? Because let's say when our adult teeth come out, when from 6 to 12 we're changing our teeth, right?
Yeah.
However much your tooth has developed,
right,
when it's in the bone, that's it. It doesn't. You're not going to be. Let's say you're drinking, gallons of milk every day. It's not going to really deposit much more, calcium onto your teeth, right? Whatever enamel has grown on your enamel surface, the outer layer, that's how much you're getting, right?
Yep.
And to protect it is what's important, right?
Okay.
To keep using, let's say, for adults, fluoridated toothpaste, right? For kids, children's toothpaste with fluoride. Or even toddler toothpaste without fluoride.
Right.
It's the more important thing is just to protect them.
Right.
Like you can't change your genetics.
Right.
And the second part is just the environmental part of controlling what you eat. Controlling your brushing habits and making sure your brushing habits is up to standard.
So in terms of the habits, you've mentioned a couple. Wait a little bit after you eat to brush your teeth. How often should kids be brushing their teeth?
Now, that's one thing that I want to talk about. Now, obviously in the morning and at night. Okay?
Right.
These two, because let's say you wake up and there's going to be a lot of bacteria in your mouth. Right. Just because...
and their breath stink.
So, one of the reasons why is that when we're sleeping, we don't actually salivate. Like, there's no saliva coming out of our glands. I mean, before you fall asleep and we're drooling sometimes, that's because it's during, the 5-10 minutes before you fall asleep. You're actually still salivating, but you're not swallowing anymore. Right? You're almost asleep, right? So because we're not swallowing anymore, or our body tells us, okay, don't salivate, otherwise everywhere your entire pillow is going to be wet, right? Without the saliva is basically constantly, going to your mouth and rinsing and causing like an effect of cleaning, because you're swallowing after, right?
Yeah.
And it acts as a buffer against, any acids that bacteria is producing.
Okay.
Right. So when you wake up, you want to brush. You want to get rid of, as much bacteria as you can. Okay. Obviously, there's still going to be bacteria in your mouth all the time. That's just inevitable, right? Now, the second time is a lot of parents miss this. Is that if your little ones, okay, let's say they take afternoon naps. You would have to brush before the afternoon nap.
Before.
Okay. Just because a nap is still sleeping.
Yes.
Okay, even just for an hour. Okay, we're not salivating during that hour. Right, we're not salivating, and the little one has had lunch or even breakfast or even a snack as well. Right, there's going to be a lot of plaque and bacteria on top of his teeth, right? Okay. And that's when the bacteria would go to work and break down the teeth. Okay, so you want to brush before the nap as well.
Wow.
Okay, so usually it's about 3 times. I mean, if your child isn't taking a nap, then it's fine.
Then it's okay.
Yeah, but morning nap, before nap, and also before nighttime when you're sleeping.
And in that morning one, would you get up and brush and then have breakfast?
I would say it doesn't really matter.
Oh, okay.
I mean, obviously, when I was talking about the timing, like let's say if you've eaten, then wait a little bit before you do brush. Right? Don't do it right away.
Okay. So this is something that I remember wondering, and I've definitely seen it on forums and in different cities, but specifically in Hong Kong, the water. A lot of people get bottled water, and they go for the mineralized water because they want it with minerals. There's a big concern over fluoride, in the waters, and are the kids getting it, and are they not? What's your take on that?
I don't really have an opinion on that, but I can just really say now what the fluoride really is for.
Okay.
Let's say the fluoride, back in the 60s when they first introduced it. it really is trying to prevent cavities, right?
Right.
Because fluoride prevents cavities, right? Now, after so many studies have been done, and now there's kind of like a half and half. Oh, should I take the fluoridated water or should I not, right? Now, I can't really advise patients on saying, okay, you should take it, just because I'm only talking about teeth, right? In terms of how it affects the body, okay, you would have to ask medical doctors on that, right?
Yeah.
Right.
But in terms of affecting the teeth, or does it protect teeth? Obviously, it does protect teeth in a sense, right? But I would say, in terms of brushing with fluoridated toothpaste, that would be enough.
Oh, okay, that's good.
Right, because
Reassuring,
fluoride is something that you want it on the surfaces of your teeth,
Okay.
right? To help prevent cavities.
Okay.
Okay. Like I tell all parents, when they come in, okay, I would ask them one thing: are they swallowing their toothpaste? Or
Right,
the kids,
right.
okay.
Yeah.
Just because there is a condition called fluorosis,
Right.
okay, and that's where the kids are swallowing too much fluoride, and the fluoride is getting into their bloodstream, okay.
Right.
Now this is, let's say, for kids around 2, 3, 4, 5, 6
Yeah.
even, okay. And what's happening is during that age span, the adult teeth are developing inside the bone. Okay.
Right.
Okay. And you can't see it, but it's developing.
Right.
Okay. The dentine layer, the enamel layer, is all coming together. Okay. If during that age you're swallowing too much fluoride, if the kids are swallowing too much fluoride, the fluoride actually inhibits, it stops the enamel from growing properly. Okay. So that's what fluorosis is, right? Basically, enamel defects due to having too much fluoride in your system. Okay. In mild cases, what you'll see when the teeth actually come out, the adult teeth actually come out, is that you'll see little white spots.
Okay.
Okay. So these are early lesions on the enamel. Okay. They're still, pretty hard.
Yeah.
They're still solid and sound, but they're weaker than normal enamel, right? Now, in more moderate cases, you would get brown spots.
Okay.
And that are easy to chip off
Okay.
or easy to break down because there's more pores and holes in the enamels now, right? And in more severe cases, severe fluorosis, the enamel would just not grow,
Right.
and you wouldn't want that, right?
Yeah.
Because that's very hard to repair.
Uh-huh.
And you would have to, think about the first 2 teeth or the first 4 teeth are coming out at 6, and you're getting all these enamel defects.
Yeah.
It's very difficult as a dentist to treat just because the kid is so young.
Yeah.
And it's so difficult for the child to come in and asking what's going on with my teeth, and then having, okay, how come I have to do all these treatments? I've been brushing my teeth properly, and they wouldn't understand, right?
Yeah.
So it's very difficult for them as well.
Because it's hard to stop them from swallowing it.
Yeah.
Especially when it's bubblegum flavored
Yeah.
and
Well, I was going to ask that about the flavours. I remember being told in the UK, like from a midwife after my daughter was born, I thought it was like weird, but it stuck because it was so soon afterwards. But she was like, whatever you do, start them when you start brushing teeth, start them on a mint flavoured, spearmint flavoured toothpaste because that's the closest to the adult. And if you start them on like a fruity flavour, sometimes you can really struggle to switch. Like, would you agree that? Because a lot of the ones in the store
they do taste good.
are like
Yeah, they do.
cool bubblegum flavour and stuff.
Whatever helps to transition them works, right? It's really depends on the child.
Yeah.
Some kids are actually coming in, always using, they prefer the mint flavor as opposed to, the bubble gum or whatever.
Yeah.
But it really doesn't matter, I think. It's just positive reinforcement is always what I tell parents, right? Because there's nothing that we can really do to prevent the kids from doing certain things, even in life anyway, right?
Yeah.
How about, brushing, right? We have to just encourage them, let's say, with Peppa Pig, there's a episode on brushing the teeth, going to the dentist, right?
I actually remember that one.
I would always advise parents, just try to give them a positive feedback,
Right.
about having done something well. Also, okay, let's say with even just brushing, right? That's something that's very important.
That's good.
One thing I'd like to add is that, let's say if the kids are swallowing the toothpaste,
Yes.
okay, you have to make sure that there's no fluoride in that toothpaste.
Okay.
Yes.
Right.
Okay. Yeah. If
Because
they have a habit of it.
Yeah, Okay,
Before
so
you can-
until they learn actually, I have to spit everything out, that I'm not supposed to be swallowing this, then that's the only time you can switch to a fluoridated toothpaste.
Okay.
Otherwise, keep them on a toddler toothpaste.
Okay.
But by the time they're 3 or 4, they're starting to learn I have to spit everything
Yes.
out.
Yes.
That's why children's toothpaste usually is labeled 4 to 6.
Yes.
Right.
Yep.
Yes.
Yeah. What about mouthwash, flossing, some of the other things that we as adults
Sure.
do? I see the kids' mouthwash at the stores, but
Yeah.
is that...
The kids' mouthwash is good. I mean, there are some mouthwash that are called plaque disclosing agents. It's got
Right.
some plaque disclosing agents on there. So basically what happens is, let's say they rinse and they spit out, and any plaque that's left on the teeth that they haven't properly cleaned off, it changes color.
Oh.
So it shows them that, these are the areas that...
Do they have the
haven't-
adult version for this? This sounds great.
No, I mean, you can use it as
I guess
well,
you can use
right?
the kids' version.
Well, that might be a bit scary.
So, I mean, that you can, go ahead and try to find out where it is if you think it's necessary for your kids,
Okay.
right?
Okay.
But let's say you can't find it, how do I check, right?
Yeah.
Usually you just take a look at the gum line,
Yeah.
okay, where, the crown of the tooth meets the gum,
Mm.
and see if there are any, yellow plaque lines on there. I
Okay.
mean, plaque is very easy to scrape off.
Right.
You can scrape it off with your fingernail, you can scrape it off with a toothpick, anything like that.
Okay.
So, with a toothbrush, you can definitely brush it off.
Right.
That's how you have to check. I would
Okay.
say, for the parents.
Mm.
Right.
And flossing with kids? I mean,
Yeah. Now, flossing is, I would say it's important. I mean, I think there's some videos or, on social media now saying that there's been some studies saying that flossing has no effect.
Mm.
Something like that, right?
Addicted.
But, I would always advise my patients to floss.
Yeah.
Okay, because let's say you're cleaning the outer surface of your tooth with
Yeah.
the toothbrush,
Right.
the inside surface, but how are you cleaning the middle surface, in
yeah.
between?
Right.
You can't take out your tooth and brush them in between
Yeah.
and then put the tooth back in, and that's where the flossing comes in,
Got it,
right?
okay.
Especially at the contact point.
Yes.
Now, with kids' teeth, the contact points are always very tight together,
Right.
and they're not always brushing 100% already.
Yeah.
Mm.
So you want to help them floss. Okay, just between those areas, just to make sure it's clean, that there isn't a piece of meat stuck in there.
Yeah.
Right.
Otherwise, it's definitely going to turn into a cavity.
That's hilarious. That's my next statement. That sounds like a difficult one. We've got a question come through.
We have a question about
Sure.
flossing. So Katrina asked if you can give any tips on how to help kids floss.
Okay,
Mm.
now I do understand how flossing can be difficult for kids. Just let's say they're always moving around.
Yes.
Right here, they're lying down like this flat,
Yeah.
and you're flossing over them.
Oh, okay.
Okay, so
Okay.
on the bottom, then you'd be able to floss very easily, and to floss the top, you're just looking over them like that.
Okay.
So just like how I would do in the dental
In the
office.
actual.
Okay.
And that would be a lot easier. Then they're not wiggling around, they're not moving
Yeah,
around,
you're
because
not
they're lying
lying.
down right.
Yeah.
Yeah.
Yeah, so that's how you can do it.
Cool, thanks. Yeah, if anyone's got any more questions for Dr. Nicholas, please send them over. I also wanted to ask around the dental visit side of things.
Great.
What is the recommended age that a child should come for the first time to see a dentist?
Now, usually, some patients' parents bring them in, I would think, too early.
Okay.
I mean, sometimes I'm seeing kids who are 1 year old or 1.5.
Okay.
They can barely open their mouth, and all I'm seeing is 4 to 8 teeth.
Oh,
Okay.
yes.
That would be a little bit too early. Okay. I mean, unless there's actually a very dark spot that you can see on the teeth,
Some
or
issue.
they've
Worrying.
banged their teeth or something like that. Okay, that would be too early to bring them in. Usually, I tell the parents to bring them in when they've gotten all their teeth, and that's
Okay.
20
Okay.
baby
Wow.
teeth.
Okay.
And usually that's around 3, 3.5.
Okay.
When they a little bit older, so then they actually understand what's going on when they need to visit the dental office. It's
Right.
easier for the parents, also easier for me as well.
Okay, because
Right.
they have an understanding, you can talk through
Yeah,
the situation.
Yeah.
Okay.
Otherwise, they would just be very, very apprehensive.
Mm.
They would cry even just before they've gone through the door.
Yes.
Right.
Right.
So a little bit older, just 3 or 4, and when they've gotten all their teeth, all their baby teeth,
Okay.
that's a good time for a first visit.
And what would actually happen on the first visit? Can you talk us through?
Okay, so now with me, the first visit, obviously the TV,
Peppa Pig.
Peppa Pig, right? So we've got our instruments, right?
Yes.
So usually what I do is, I ask them, okay, do you want to play a game first? Okay, because once they hear, okay, we're doing a game, they relax, right? Yeah. And then they're also watching the TV. They're half just listening to me, half thinking about, okay, I'm going to be playing a game, right? Now, so the first thing that I do is we've got that air spray that we use to, dry our teeth, so I can see better. So I use that, and I use a glove, and we make them a balloon. And, that's amazing. The balloon, which kid does not like balloons, right? Everybody loves them, right? So once we've gotten through with the balloon, they're actually making it with me. Yes. They're pressing the button. So then they're familiar with that. They know that this instrument is safe.
Right.
It's actually fun to play with. Yeah. Right. Then the next step is I would show them, how the chair works. Let them press the button. Let them, experience how this chair goes down to bed. Okay? Yeah. And then I would show them the mirror. Okay. And then they get to hold one. I get to hold one. And then I tell them, okay, you're my little helper. You're going to help me today. We're going to look at your teeth. Yeah. And usually they're pretty good with that already. And then usually that's the first visit. We're just going to take a look. We're just getting used to the environment, so then they know that they're safe. It's fun here. Yes. Okay. And then at the end of looking at the teeth, we give them a toy to go home with, and that's a positive experience. Yes. We start with that. Right.
It's perfect. Right. It works so well. I think it's also
I like the balloon trick. It's genius.
It's also like a control thing, like that they are also in control, so they don't feel so out of control with all the utensils and, as you say, that intimidating experience. And when they get to press the button, and what I mean, it's like, oh, we're part of this too, and it really works, which is why I think you have this amazing cult following. So fearful kids, what else would you do from even that is a fun experience, but if they are really anxious,
holding on the door
and nervous and stuff like that, are there kind of other tips that parents can do, other things that we can help to kind of manage that in the kids?
So usually with fearful kids, let's say at home first.
Right. Yeah.
Okay. I always tell patients, let's before this, okay, let's say they've come in first time already, and they're actually really scared to come in through the door, okay, and all I've gotten to do is, really take a look while the parent is holding the kid, right? Okay. I would send them home after, taking a look if I'm able to. Yes. They would have to introduce the kids to, actually going to the dentist. Okay. Books, right? A book on going to the dentist, okay. Read it through, let's say once a week. Yeah. Coloring, like colored books, picture books. They love it, right? Yeah. One book on brushing their teeth. Yeah. So 2 separate ones, and then even just watching, Peppa Pig sometimes.
The episodes.
With going to the dentist. These are very, very helpful. I mean, just showing them that it's actually not too bad going to a dentist. It's a very unfamiliar situation, but there are these other things that they've seen in cartoons or books that they can relate to. Yeah. And when they come in thinking, oh, it's just like the Peppa Pig episode, something like that. And then it really helps them to come next time and to build a rapport with the kids, right?
They do have really good, interactive. I know there's been the Sesame Street ones where it's interactive. And you take out and you brush the teeth and you count them and you go through the whole process. And I think we also did a search on YouTube for their favorite cartoon characters and trips to the dentist to try and get them to watch. What happens.
There's always that one that went viral too, the kid in the back seat.
Yeah.
Maybe not that one.
Yeah.
I think we have a question coming in.
Yeah, so we have a question from Georgina that her 6-year-old still sucks her finger and she still has all milk teeth, and will this have any effect on her teeth and will they buck?
Okay, so let's address the thumb sucking first. That's very important, actually, because by the time you're 6, there shouldn't be any thumb sucking. Okay, even by the time when the child is 3 and they're still thumb sucking, I would already tell parents to, you gotta wean them off thumb sucking right away. Okay. Because that's a problem that's gonna change their bone structure. Okay, so if you imagine your thumb is going into the mouth, okay, the top teeth is like this usually, and it's biting on the bottom teeth, right? If you've got a thumb in here, you're always having a gap. in between the top and the bottom.
Okay.
Now that's the thumb is going to push the lower teeth inwards,
Right.
and it's going to push the upper teeth outwards. Okay. So also one other thing is the arch, the bone structure.
Right.
Okay? If you're sucking, there's always a pressure that's coming in, right? And it's going to pull the palate in, you know, the top part of the jaw. So what's going to happen is the jaw is going to become more narrow at the top.
Oh, wow.
And you would get a crossbite at the back, meaning that the teeth at the back, when they're colliding together, instead of the top being on the outside of the bottom teeth, it's on the inside.
Oh,
that pressure.
Okay, so you got a bite that's different from how it should be.
Okay.
The front teeth, okay, it's pushed forward, right?
Yeah.
The top. And the bottom teeth is pushed back. So then you would have an open bite.
Okay.
So, and you're effectively changing the bone structure, okay, which is very hard to correct later on. You would need to have some growth modification later on, early orthodontic treatment, okay, if this persists. So that's why I always tell the parents, okay, you gotta take them off the thumb sucking really early.
Wow, that's hard.
Once again, positive reinforcement. Replace it with something else, right? That doesn't go into their mouth, okay? Even if it's a blanket or something for comfort, but you know, not into the mouth though. Okay. So that thumb sucking part is very, very, very important. That it needs to be off right away.
And then when you say early orthodontist, so this child's 6 years old, what would be the next? I mean,
she's still got her milk teeth, so she'd need her.
Right now, the milk teeth part. Everybody's different. Every child is different. Usually, the first 2 milk teeth changes. You know, some patients start changing when they're 5.
Yeah.
Some changes when they're 7.
Okay.
Right? But I mean, the usual is 6, right?
Okay.
Okay. But you know, if the baby teeth came out a bit later, you know, let's say than her peers or his peers, okay, it would come out a bit later for the adult teeth.
Okay.
When they're a bit older, right? So I would say if they're 6, still have all their baby teeth. Not too much to worry about.
Good.
Okay. I mean, if they're 7 or 7.5 and they still only have baby teeth, then I would worry a little. I would go in, have a check, you know, maybe take an X-ray just to see if all the teeth are there, like all the adult teeth are there.
Yeah.
But usually around 6, you would notice the first 2, the bottom 2 in the middle, would start to become wobbly.
Right.
Okay.
And these 2 are the ones that come first.
Okay.
Right. So you know, when they're 6, still milk teeth, no problem. Don't need to worry too much. It's, you know, probably getting there, probably wobbly already. Those 2 in the middle.
Yeah.
But the thumb sucking is really a no-no.
Okay.
And so with the what Georgina was saying is because you could already be at 6 changing the shape, that means it would affect the new teeth coming out because they would just follow the shape of the gum, right?
Yeah.
Okay.
Shape of the bone.
The bone, yeah.
Right. And and to address the early treatment part is once that happens, okay, and it's really hard to, you know, change it back.
Right.
Like, even if you stop the thumb sucking and you've already got an open bite, the palate, the top part of the jaw is already narrow. There's no way that you're going to be pushing it in every single day, right? And that's what early orthodontic treatment is for.
Okay.
So early is you're looking at around 8 or 9.
Okay.
Wow,
Okay. Before the child is hitting puberty, and you would want to change the bone growth.
Okay.
Then, and that's when, you know, as a dentist myself, I would refer the patient, the kid, to an orthodontist to have that early treatment. It's unpleasant for the kids though, just because there would be appliances going on inside the mouth, and hence the importance of, you know, not thumb sucking or of stopping it early.
Okay. Cool. Good question. Thank you. How often should kids be visiting the dentist once they start?
I would say the same as adults, 6 months.
Okay.
So it's just 6 months for a checkup, for a clean.
Okay.
Or now for me, let's say if I've done a checkup for a child.
Yeah.
And I've noticed like a couple cavities.
Yeah.
I would book them back to fill the cavities, you know. And after I filled those cavities, I would book them back in 3 months for a review.
Okay.
Because if they've had a cavity or 2 or 3, that means they are prone to having cavities, or they have a risk of having that.
Okay.
And with kids' teeth, they're very small.
Yeah.
The enamel is very thin. The dentine layer is very thin. Once you get, you know, even a dot of a cavity, it becomes very big within a month if it's not cleaned properly, or if it's not dealt with. Right?
Okay.
So that's why when I do the filling, I've done the filling, I would tell the parents to, you know, improve the oral hygiene, improve the brushing, the flossing, you know, mouthwash, whatever that you're using to clean. Then I would want to see them in 3 months just to make sure that, you know, it's the oral hygiene has improved and that they don't have a new cavity.
That's good.
All right, and then if they don't have anything, you know, no new cavities or the teeth are clean after 3 months, then I switch back to the 6 months.
Okay.
Yeah.
And when they have a filling, do they also have to have the injection?
Not every.
Okay.
Usually for kids, if the filling isn't very deep,
Yeah.
Oh, okay.
right, we're only drilling for a few seconds.
Okay.
They're okay with that. I mean, even for adults, I don't always, you know, have an injection for a very, very superficial surface filling.
Okay.
Right?
Cool.
Usually with kids, if I have to do an injection, usually that filling is very, very deep.
Okay.
So deep that, you know, it might be more than a filling. It might be a root treatment for the kid because the filling has already gone into the nerves.
Okay. And if they have a cavity on their milk teeth, how does that affect their underlying adult tooth?
Oh, that's a good question.
Now, with just a cavity, not so much, because it's still localized on the tooth itself.
Above, right.
Above, right. Now, you have to think about the anatomy of where the milk tooth is and the adult tooth. It's just right underneath,
Yes.
right? Now, if you have a cavity that is so big, it's already affecting the nerves, and the baby, you know, the baby tooth is painful.
Right.
Then, just like adults would, we would need root treatments, right?
Yeah.
If you don't treat it, that means you've got bacteria in the roots that would go into the bone area just adjacent to the adult tooth, which can be is still growing, okay? And that can affect the surface, okay, or whichever layer that's still growing on the adult tooth. Okay? And that's why you would want to have an early cavity or like treat it as soon as possible so that it doesn't progress to a big one,
right?
And then
affect the nerve part, because small cavities are easy to fill.
Yeah.
With kids.
Yeah.
Okay. Well, it's not easy already, right?
Right.
Yeah.
But easier compared to, let's say, a root treatment for kids, because then you would definitely have to do anesthesia, injection,
Right.
and you know, just hearing that for them.
Yes.
Yeah.
Yes.
It's
For
scary.
me, it's like
Right. So that's why you don't want to wait too long to treat
Make sure
anything
that
for
it's okay.
kids. Yeah.
I have a question on like genetics versus habits and you know hygiene, general hygiene. I know that you know some people have weaker teeth, or what is your take on just if you've got a child with genetically weaker teeth or deeper grooves, or is that something that you just need to work harder, or you just need to? What is your take on that?
Now, if we're born with weaker enamel, okay, let's say that fluorosis part.
Yeah.
You know, when or some kids back in the 70s, okay, let's say when we were still giving tetracycline antibiotics, right? That would stain the teeth or weaken the enamel, right? That's just something that you have to work on harder for brushing.
Right.
Okay? If you're getting some extra grooves in your enamel, you know that's always getting food stuck.
Yes.
Okay?
Yeah.
You just have to spend a little bit more time cleaning it off.
Right.
Okay. You have to spend a little bit more time helping your kid to you know brush after they've brushed.
Right.
Yeah.
Right. I always tell my parents, my patients' parents, this is that teeth will never have a problem, even if you eat anything, even if you entire day you're eating a lot of sweets or anything like that, as long as you're making sure the teeth are clean.
Yeah.
If there's no plaque on the teeth that's stuck, you know, before you go to sleep, that means there's no bacteria on, you know, the surface is stuck on there to actually break down your enamel, right?
Yeah.
Okay.
So as long as your brushing techniques are good,
Right.
you know, you're doing the brushing, the flossing, you know, you're backing up with mouth rinse, you shouldn't have any problems, you know, regardless of your genetics.
Any differently, yeah.
Yeah.
Okay.
Right. Some people have, you know, crooked teeth.
Right.
Right. You know, and it's very hard for them to brush every single area with just, you know, one stroke of a toothbrush.
Yes.
So they have to spend a little bit more time flossing or brushing those areas.
Okay.
Right? So that's unavoidable. But as long as you're keeping every single tooth clean, every single surface clean, you're not gonna have a problem.
Right. Okay. Question on sealants. Is that something that you recommend at a certain age, or I know when I was younger, I had sealants all in one go once I had all my adult teeth in. But I understand now they recommend kind of in 2 phases sometimes as well.
I would recommend it.
Yes, a sealant.
Oh, yeah. Well,
a fissure sealant.
Okay.
Okay, so we've got these grooves. Let's say on the molars of our teeth, we've got these fissures and pits. Okay.
Yeah.
That it's very hard to brush.
Okay.
Right.
Yeah.
Or food can get stuck in, and you know sometimes we're missing those areas, right? So fissure sealants basically is just a layer of resin, you know, that turns hard and it stays in those fissures.
Okay.
It's not going to change the bite because you know you're not really biting into that fissure.
Right.
You're biting on the cuspal areas, right, of the tooth, right?
Okay.
So essentially, it seals those areas and prevents you know food and bacteria from getting in.
Cool.
Then you don't have any, you know, cavities in those areas. Okay, a lot better for you know children's teeth. Actually, I would recommend it. Usually, I put them on teeth, the 6-year-old molars.
right.
Yes.
So when kids are around 6, okay, their first molars would come out on each
Right.
side.
Yeah.
Right? 1, 2, 3, 4. Right.
Yeah.
And these 6 molars, once they fully come out, the kids are probably still not
Getting
brushing
there. Yeah.
that, and it's an entirely new tooth, a bigger tooth with
Right.
deeper fissures, right?
Right.
And I would suggest the parents to have them for those 4,
Oh, cool.
just because if they're not cleaning it,
Protection. Yeah.
they're not getting that tooth again.
Yeah.
They're keeping that for life.
Yes. Yes.
And
So-
6 till 100. you know,
Yeah. Look
they
after.
want to have it looked after.
Oh,
Right?
that's super cool.
And it's pretty easy. It's not because
yeah.
my daughter just had him put in for those 4.
Right.
And it was easy. It was like
It was.
there was no shots, there was no
Yeah, no
just
shots.
brush on.
So basically, all we just do is we apply a little bit of a gel to
Right.
clean the surfaces of the fissures, and then we dry it, and then we place the fissure sealant on, and then we cure it with the light. The light takes about 20 seconds, and then so
Wow.
each tooth is if the patient is sitting still,
Yeah.
of course.
Which has been easier, a little bit easier at that 6-year mark.
Yeah,
But,
especially.
Oh, that's
Yeah.
cool.
Then you're done in let's say 20 minutes.
Okay.
So it's not something that's difficult for the kids. All they need to know that is there's going to be water going on in my mouth.
Yeah.
We're going to be getting rid of it with the suction.
Yeah.
Okay, there's going to be some air.
Yeah.
The same spray that we're making the balloon
Yes.
with, and they should
And
know
you're a
that
bit
by now.
older anyway,
Yeah.
so
But it's
a little
easier.
bit easier.
Yeah, so it's not so hard to do the fissure sealants, and it helps them because I see teenagers or even adults who are in their 20s now, they still have their fissure sealants on protecting it. So it does last quite a long time.
Okay.
Yeah.
Oh, that's cool.
So I just have one more question before we move into some of the other questions
Sure.
that the readers have. In terms of future innovations, things that are happening both in dentistry but also in just kids, dentistry.
Right.
Are there any things to kind of highlight and keep an eye
Um, kids dentistry hasn't really changed too much.
except the electric toothbrush.
Yeah, electric
Yes,
toothbrush.
that one's got
I mean,
timers and fancy.
I would focus more on not kids dentistry, but
Okay.
more on kids oral hygiene techniques,
Okay.
right? I mean, as we're getting more, computerized and everything, with electric toothbrush,
Right.
anything that can assist the kids,
To help
to
them.
help them, even just watching a show while they're brushing, and that show is about brushing. Okay, These are some of the things that we didn't have back when we were kids, right?
Yeah.
Okay, so these are the things that could help dentistry, kids wise. But in terms of actually going to the dentist and doing the work and drilling or doing a cavity or something like that, that's still pretty basic and remains the same. I mean, with adults, obviously we get more computer assisted dentistry nowadays.
Right.
Yeah.
That really isn't suitable for kids because all they really need is usually a clean or a filling, right?
Right.
Yeah.
Yeah.
And teeth whitening, that's what I like to call
Right.
it. If that helps.
So, I mean, teeth whitening, I would advise adults to really, if you're looking into it,
Yeah.
you would have to consult a dentist first.
Okay.
Okay, because there's so many products
I know.
online now
Yeah.
that they're selling that it's very hard to judge. Okay, is this right for me, or
Yes.
is this product good, or is it going to damage my teeth, right? And because not every patient is suitable for whitening.
To do it.
Okay.
Right? Because let's say if we were talking about genetics first, some people are born with weaker teeth, weaker enamel.
Right.
Okay, and let's say the surfaces are already, cracked, or there's dips and the enamels have been, brushed away, things like that. If you're doing whitening, you might cause this, the sensitivity, let's say, okay, for one, okay, it would be even more sensitive if you're doing the whitening.
Yeah.
Okay, if you've brushed away part of your enamel, okay, and those areas, let's say if you just buy some product online, they're not going to tell you, don't apply it to those areas where you've brushed it away. Right? So that's why you have to go to a dentist to consult first. And to make sure you know what product you're using. Because whatever you're buying online, most likely it's not regulated by certain dental institutions. And in Hong Kong, the dental society, we don't recommend doing dental teeth whitening without dental supervision.
Right.
Right.
But it's one of those things like your hair, like why would you take that risk? Because it's such a big effect on your, on your whole
Exactly.
feature, looks.
And hair does grow.
Cool. Just wondered if there were any other questions that had come through for Dr. Nicholas.
So we have a question about sugar-free gum.
Sure.
Is it a bad thing? Is it a bad thing if kids love?
Maybe just gum too in general.
Yeah, gum too in general. Now, gum's not a bad thing. I mean, let's say there are gum with xylitol,
Yes.
right? And that helps prevent cavities. The studies have shown. But I would say eating too much gum is not necessarily a bad thing for the teeth, okay, but for your jaw. Because constantly you're exercising that area, and when you're chewing gum, you're chewing hundreds of times.
Yes,
it's true.
Okay, and if you're doing it on hours on end, okay, you're gonna be using the jaw too much. Okay, and over time, you might feel that soreness, okay, in the muscle here.
Yes.
Okay, or in your jaw, and that's actually damage.
Okay,
and you don't want to do that because over time, if you're chewing too much, we have this joint called the temporomandibular joint. And
say that 5 times.
And if you're exercising that too much, if you're using that too much chewing gum, there's a disc in the middle between that joint, okay, that would wear down.
Wow. Okay.
And then you would start to hear some patients have these disorder where it clicks, right?
Oh gosh, yes.
And the clicking, over time, if it gets too severe, if the disc is wearing down more and more, it would be painful. And how do you replace that disc? You can't.
Okay.
Right? Unless, if it's very severe, it's surgically replaced.
Okay.
But still, it's nothing like what you were
kind
born
of
with.
gone. Yeah.
So as with everything, moderation.
Yes.
Any others?
So there's another question with dental x-rays. So
Oh yeah, that's a good one.
So with kids, we want to reduce the radiation to a minimal. So how often should they really be getting x-rays?
Now, for me, I'm quite conservative about x-rays, okay? Like, let's say diagnostic x-rays. I mean, if the parents really wish to have one done, max once a year is enough, okay? As with, adults. Once
that's
a year
adults
is
as well,
fine. Like, you don't need it more than that unless
Do you even need to have that once a year? I mean, I think that's
now,
like if you have no problems, then...
With the kids, I don't usually take too many diagnostic x-rays unless, I see that they have a high caries risk, high cavity risk.
Okay.
Let's say they come in before they have cavities.
Right.
And then every half a year they're coming in and they get new cavities. Okay, I would recommend those x-rays every year.
Okay.
Or maybe even half a year then, just because they have a high cavity risk.
Right.
But if they come in multiple times over, a 2-year span, 3-year span, and they've never had one cavity, we don't really need to go through with that x-ray.
Right.
Okay.
Same with adults, but now with adults, because we've got more teeth, and it's harder to see in between the areas of the adult teeth, especially at the back, the molars, right? Then once a year for those x-rays, just 2, diagnostic x-rays would be enough.
Cool. Wow, what an interesting session and chat and great questions, and we've learned a lot, so thank you very much, Dr. Nicholas, for coming in today. Thanks for joining us. We'll be back next Monday morning with Angie from Body Talk. So look out for that. And thank you, Dr. Nicholas Tsang.
Yes, thank you.
Thank you very much. Have a good day.